Okay, hi friends. So in last video we already seen that the what is meaning of antihistaminic agent, then the what is mean by histamine, then structure of histamine and the synthesis of histamine. Okay, these 4 points we already cleared and you better way you understand well for these points. So next part is that, see, part 2 is the histaminic receptors. What are the receptors present in a histamine? So there are 4 types of receptors are there which are present that in histamine. Like these are the 4 receptors of the histamine which bind and gives the actions accordingly. Okay, according to their actions. So what are that? What are the receptors are there? See, this is the table. This table prepared for the easily understanding the exact meaning of the receptors and their actions and their locations. Okay. So according to that, we can say that, see, this is the H1 receptor, H2 receptor, H3 and H4. These are the 4 receptors which are present in histamine. So better way to understand these receptors, where there is a location of these receptors and what are the effects on the body of these receptors. Okay, better way. So if you understand these receptors, then you definitely understanding the classification of antihistaminic agent. Okay, so the totally classification of antihistaminic agents, it depends on these 4 types of receptors. Okay. So first of all, you understand the meaning of exactly what are the locations and effect of these 4 receptors. Just put down this like a table. Okay. First of all, location for H1 receptor. It is located at the smooth muscles of lungs and GI tracts. Lungs and GI tracts. Next, it is present in the CNS neurons also. CNS neurons and the vascular cells of heart, T cells, beta cells. So okay, these are the locations of the H1 receptor. Next is the effect of what are the effect? It will effect on a pain wherever pain is there. This we can use this drug. Then vasodilation, the dilation of the vascular muscles, vascular dilations. Okay, hypotensions. It is used in hypotension, headache also. Then severe allergic reactions, different allergic reactions, responses, we can use this also. Next is the increase in vascular and permeability. These are the some effects of this H1 receptor. Next we will go towards the H2 receptors. H2, in that location of this H2 receptors is the gastric parietal cells, then the vascular smooth muscles, and it is also present in a CNS, heart and the uterus. Okay, these are the location. Simple, you just understand the locations of these receptors. Then effect of the H2 receptor. H2 receptor effect, increase the gastric acid secretions. Okay, it is increasing the gastric acid secretions. Then vascular permeability and vasodilations. Okay, these are the effect of this histamine on the body. Next is the H3 receptor. It is mostly found in a CNS, central nervous system. Okay, CH3 receptor, and the effect of this H3 receptor is inhibition of the histamine release in CNS activity. Because of this receptor present in mostly in a CNS, so it is acts on a CNS activity in inhibition of the histamine release in a CNS. Okay. Next, last receptor, that is H4. It is present in a hematopoietic cells. What is meant by hematopoietic cells? It is present in our blood cells. Okay, mostly blood cells. These hematopoietic cells are present. So, what are the use? That is effect of the H4 receptor is modulate the immunofunctions. Modulate the immunofunctions. So, these are the different 4 types of receptors we understand. Okay, in a histamine, and their different locations are there. Also, there the different effects are there. So, this is the just part 2 video. In that video, we'll see the already histamine receptor, 4 types of receptors, and their locations and the effect of of the receptors. Okay, so in next video we'll see the classification, that is of the antihistaminic agents. Okay, these are the small videos which help to you understand very well. So, and subscribe my channel, so you will get the more videos for the education purpose. Thank you so much.